Let's talk a little bit about tearing. Now, tearing can be a really significant problem. It can really negatively impact people's quality of life. Most patients who come in to see me about tearing have a tissue in one hand and they're constantly dabbing. And many find it difficult to read because the tears well up in their eyes and blur their vision. So, tearing can be caused by a lot of different things. I think it's helpful to break it down to a problem of too many tears being produced or a problem of not enough tears being drained. So you can think of a bathtub, right? You have your tap. Your bathtub can overflow if your tap is turned on way too high. It can also overflow if your drain is clogged, right? So usually when I see a tearing patient, I start by evaluating the anatomic or the structural outflow pathway. That's where I start because those are the easiest problems to fix with surgery. So when we try to examine these pathways, we use a small cannula and flush some salt water solution through. If you can taste this salt water solution in your throat, then your pathway is open. If that salt water solution instead comes back up at me, then based on the pattern of how it comes back up, we can determine where the blockage is. Different surgeries are used to bypass blockages at different stages in the lacrimal drainage system. But in general, if there is a blockage and it can be opened with surgery, usually that is an effective way at improving tearing. But say the drainage pathway is open. Well, then we need to look at reasons why the tap could be turned on too high, causing that bathtub to overflow. There are some common reasons for that. Probably the most common reason is actually having dryness of the eye. Now, I know this sounds very counterintuitive, right? Patients are telling me that they're tearing too much, producing too many tears, and I'm telling them that their eyes are too dry. But the way that this works is that when the eye becomes dry and irritated, it sends a signal up to the brain saying that it needs more lubrication. And this starts the pathway to produce more tears. But the issue is that those reflex tears that are produced are really not great quality. They don't actually do a very good job lubricating the eye and improving the comfort of the surface. And so they don't really help stop this signal, right? This signal that's coming from the eye to the brain saying, hey, I'm dry and irritated, I need more tears. And so you get into this cycle where there's this constant stimulation to produce more tears. So even though your eyes are wet, actually using an artificial tear like a lubricating drop can be helpful because it's a better quality tear than the reflex tears you're producing. And so it will help to interrupt that cycle. As you lubricate the eyes better, the eyes will send less of a signal to the brain saying that they need more tears, and you can turn the tap down a little. There, of course, are other causes to have too much tear production or have that tap turned on too high. You know, this can include things like eyelashes scratching the surface of the eye, inflammation on the back surface of the eye if you use your contact lenses a little bit too much, and a whole host of other things that can be examined for in the clinic. The last part that I would like to talk about is the tear pump. Now, this is basically how the tears get from the surface of your eye into that drainage pathway that we started out by assessing. The blink is really important for this. And in the blink, the eyelids contract, right? So it helps to seal off the opening to the drainage pathway, these two little holes in your upper and lower eyelid. And as they're sealed, that blink creates a negative force which pulls the tears down the system. So if you have weakness of the muscle that's responsible for that spontaneous blink, you can also have issues with the tears welling up and building up. That's a really difficult problem to fix because right now we don't have a way of making that very small, very fine, delicate muscle function better. And so usually in these situations, we are trying to focus on improving the overall health of the surface so that we decrease the amount of tears being produced. Really, at the end of the day, in many cases, if there is not a discrete or identifiable individual problem, like a nasolacrimal duct obstruction or a blockage higher up, then it really comes down to trying to improve all of these different areas as much as we can so that we minimize the impact that tearing has on quality of life.